A 2023 survey conducted by the African Center for Torture Victims has registered 1,235 victims, signaling the persistent problem of torture in the country. This, in spite of a comprehensive anti-torture legislative framework in Uganda, incidents of torture continue to rise.
In 2023, the African Center for Treatment and Rehabilitation of Torture Victims registered 1,235 survivors of torture, of which 505 are male and 398 are female. With the different centers, Gulu registered 342, Kampala 244, Karamoja 251, and Kasese 66.
The report identifies security agencies as the primary perpetrators, with the 353 attached to the UPDF only.
Security agencies still rank high in allegations of torture perpetrated, with a worrying trend of torture meted by private individuals. The Uganda People's Defense Forces with 353, Uganda Police Force with 175, Uganda Prison Service with 14, and private individuals rank third with 160 cases.
African Center for Torture Victims is now advocating for a swift adoption of a national rehabilitation policy for torture victims to ensure that the survivors can access the care and support they need to rebuild their lives.
Develop and adopt a national rehabilitation policy for torture victims and survivors. Secondly, the Ministry of Foreign Affairs to ratify the optional protocol to the Convention Against Torture, OPCAT 2006. Thirdly, Parliament of Uganda to enact the Witness Protection Bill 2015 and National Legal Aid Bill into law. Fourthly, the Uganda Police Force to code the Prevention and Prohibition of Torture Regulations 2017 forms to enable effective investigation and documentation of torture and the prosecution.
The center has also implemented various measures to assist survivors directly, like offering medical, psychological and legal support to help them recover from their trauma.
We have established a fully fledged rehabilitation center in the Karamoja sub-region in Kabong district, which was launched this month. Continued providing of holistic rehabilitation services to survivors of torture and violence. 869 survivors were offered medical treatment, 502 male and 367 female. 88 survivors offered psychological services, 35 were male and 53 female.
Mary Namkose, BBC News.